Start with the questions, and then you can just respond how you'd like. And feel free to elaborate if you have anything significant. Well, first and foremost, we just wanted to understand yourself better and what you do. And you seem to be quite accomplished. And we wanted to understand what made you want to become a surgeon specializing in cardiothoracic surgery, bioenergetics, and cardiac transplantation.
I First of all, I mean, I'm very passionate about what I do, but I'm also somebody who loves technology and loves um, a fast pace. And when I saw my first heart transplant, it was a domino heart transplant with my mentor, Magdi Yacoub in the UK.
Mhm.
Um, it was very, very moving, very emotional, very something that really said, wow, this is something that makes a difference to somebody right now.
Mhm.
And so I think that's what um, propelled me to learn about cardiac surgery, but also it was a very innovative space. It's a very young specialty. The first heart transplant was only done in 1967, and the technology was evolving very quickly. And so the appeal of that and the marriage of the two made it a very attractive to do something which could save a life.
That's a great point. That's a great point you bring up. I have many friends in Boston actually who are orthopedic surgeons, and just talking to them about what they do and why they do it. I always like to ask that question because everyone.
Yeah, no, I trained at Harvard, so
Mhm.
for me, Boston is very close to my heart. My son was born there, and that's where a lot of things happened for me, which transformed who I am and how I think as a surgeon scientist.
That's great. And so, can I have you briefly describe your involvement with BPU Holdings and IMA Framework?
Yeah, I mean, as far as I'm concerned, uh, am a user and I essentially love the technology. I think that um, I have no financial relationship with BPU, and everything is literally based on the credibility of the technology, but also how we can use it for concepts in the medical space. And so I don't really have, I mean, I see only potential. And so that's the real reason why I feel something amazing can be done.
Great. And can I ask you your thoughts on what the significance of applying artificial intelligence, AI, and artificial emotional intelligence, AEI technology in the hospital and in healthcare? And second part of that question is what do you hope to accomplish long term?
Sure. I think it's very hard to distract from humans and emotion and making decisions. And for example, if somebody were to come to you and tell you you have cancer, um, how do you think you feel?
Mm-hmm.
So you get emotional, you get worried, or if somebody tells you you're going to die, um, it's it's something that would make your heart race, wouldn't it?
Of course.
And because that surge of um, adrenaline, which is making your heart race, is the same as what happens when you're going and coming back from a run. So that's why people feel good sometimes. So it's paradoxical.
Mm.
And the fascination of having adrenaline in your system and making your heart race for multiple reasons is something that's always fascinated me. And for example, something like, I don't know if you've heard of something called voodoo death. Voodoo death is something like if somebody frightens you or puts a spell on you or say you're going to die, um, your heart races. And when your heart's racing, the adrenaline surge essentially um, freezes up your heart to make it stone-like. And
Interesting.
there is something called Takotsubo cardiomyopathy, and Takotsubo is a Japanese word which means an octopus trap, and literally your heart looks like a fishing pot where it traps um, um, octopus and fish, and essentially the heart doesn't move, and that's called voodoo death, and that causes your heart to rupture or your heart to become completely still. And it's a physical and physiologic phenomenon based purely from emotion. So
Wow.
I deal with sudden cardiac death, and I deal with life and death every day. And so I stop the heart and I restart the heart most of the time. But sometimes when the emotions uh, can control this has always been something that I've been fascinated by. And so the good news is that guess what? You can actually control it. So imagine if you had the tools in your hand
Hmm.
to predict that your heart would be stopping or you would have a heart attack. Those are the tools that would make a physician a better physician and a smarter physician for the tools that are synchronized with the biology of what happens. And if we can predict that, and if we can control the emotions, say, for example, I don't know if you've done yoga or deep breathing,
Oh, yes. I lived
and what
in New York
happens then?
City. I definitely had to do deep breathing.
Right. So, what happens then? You relax
Absolutely.
and you feel at peace. So, guess what happens to your heart rate? It slows down.
Hmm.
And your heart rate variability improves. And that's a biomarker for how healthy you are or not. And so you can control your heart rate and you can control how your heart works through your emotions, believe it or not. And so um, when people have, phobias, most of the time you're given a lot of desensitizing physiological regimens which play on your emotions to calm you down.
Hmm.
And the link between artificial intelligence, the predictability of it, the harnessing the data in an intelligent way, along with emotions, fuses the concepts of artificial emotional intelligence and artificial intelligence.
Hmm.
And as you know, there's many different forms of artificial intelligence, whether it's natural language processing, whether it's
Machine learning.
um, yeah, deep learning, and using complex algorithms in intensive care settings. And um, the long-term goal would be to create an ecosystem where when I see the patient in the clinic, I don't have to wait for hours for real-time data, mainly because I'm an impatient surgeon and I want the best for my patients and I want to make the best decisions at that point for them and calm them down, reassure them that what we're doing is the right thing for them. I have many, many patients who come to me for having heart surgery who are very, very frightened and very scared, and
Yeah.
they know that their heart may be failing or their valve may not be working and they may need to have a heart transplant or a procedure. And that's very emotional. Um, and I think what the long-term goal with building the ecosystem for artificial intelligence and emotional intelligence is to um, humanize the technology so we can become better physicians. And that's what I hope to do.
You bring up so many great points that what we at BPU are constantly thinking about, or at least I'm thinking about with Carlos, and just trying to understand how, well, you brought up the word humanize, and we say that quite often in a variation of our products and services, but you really do narrow down what we are, Carlos and I in particular, just talk about hours on end of what we can do. But leading to what you just said in your answer, and you wanted to make the best decisions for your patients because they come in and they're quite frightened and they don't really understand what's happening. How do you envision future diagnosis and treatment to be practiced in an ideal world with technology?
Yeah, good question. I see it happening on multiple levels, and if we're going to, and guess what? You can implement it now.
Hmm.
It's 6 months away. Why? Because we have the technology and we can synthesize the artificial intelligence. Now, with having all this, everybody says you need so much data to synthesize and make this neural network work and training the data sets and blah, blah, blah. Well, guess what? If you mm, focus on a single point, it's made out of billions of pixels, billions of points. And one of the guys at MIT is working on creating composites of data, which essentially means that you massively need to reduce the amount of data to recognize the patterns
Hmm.
and to be more precise.
Hmm.
And hence, precision medicine comes along. And you can use everything that you have right now. You can use through the Internet of Things, you're building your ecosystem. You have your phone, whether it's an iPhone or an Android, you can plug into your network. You're already wearing a wearable, i.e. a watch,
Hmm.
for example, which has apps which can detect your heart rhythm, your breathing rate, even your non-invasive glucose is down the road right now by using the green light. Um, so I think that, with the technology that currently exists, we'll be able to um, build your digital kind of concept or your digital version of yourself. And imagine if now you're going out for a run, but you're an athlete and your heart skips a beat at the 3 mile mark
Okay.
and it suddenly fires on the wrong part of the electrical part of your rhythm. And the adrenaline is surged, and now your heart becomes like a stone. And you go into something called ventricular tachycardia or ventricular fibrillation. You have sudden cardiac death. But imagine if the night before those skip beats were there, but you never noticed them. And now you pick them up and you realize, wow, I'm feeling a little bit under the weather today, but you know what? I'm still going to go for that run.
Okay.
And how many times have we done that?
Yeah.
And can you imagine if we could predict that in 4 miles you're going to have a heart attack or sudden cardiac death, and at 3 miles is when it started, but you were sensitized the night before, or you've been having this for a while, you are now diagnosing a condition, but you're predicting the outcome and you're influencing it. Because if you made the decision, and suppose you had a bot which basically is much more intelligent and it asks you, like Amy does, it asks you how you're feeling at random times or specific times. And imagine if now that's plugged into all your biorhythms and even blood glucose, for example, and it all weighs into making that decision to predict whether or not you could save a life. And you just did. So that's how I envision the future. I think we've got the tools right now. I think we can make these diagnoses, even in the clinic with natural language processing and using it more intelligently by having an app like Amy that could ask the patient the questions, but could respond to whether or not they are frightened or not frightened, or um, read a little bit more as a physician would into the questions. But guess what? You just saved a whole bunch of time coming in. And now I also have a history and a pattern of
Mm.
something that when you walk into my office, I know exactly what's been going on and I can make a better decision for you. and I could know that, wow, you do have kidney failure, or you are at risk of having further kidney failure if I were to operate on you. And I, as a physician, can make better decisions, have better outcomes. Um, and if I was predicting things in the ICU, that's just Disneyland for me in terms of technology. And if we can harness the power of artificial intelligence, both in the operating room and the ICU and in recovery, outcomes would be amazing. And I think we can do so much better. And I think that's the vision or the future that I feel is going to make a difference. And this is how artificial intelligence and emotional intelligence will make the difference, especially because I see them hand in hand. I don't think you can separate them. And that's the beauty of
Yes.
what AEI and AI are, in terms of they should be one for precision medicine. And that's the way I see it.
I agree. That's a great answer. You answered one of the another question I had, but I wanted to ask you, backing track to current day, for you personally, what is the biggest challenge in the doctor-patient relationship, and how can AEI and Amy and IMA frameworks help not solve it but assist with it?
It's communication and data. Uh, I think that without having, like I explained when I had a patient in the clinic, I can't make those decisions at that point in time.
Hmm.
So my communication is poor because I'm not able to synthesize data, which, if they were in my clinic, I could reassure them and calm them down to say, you know what, things will be okay. And you will be having no problems in your outcome, and your prediction or your risk for having surgery is much more reduced um, than if it were to be a younger patient with morbid disease. So I think the synthesis of data in a smarter way with AI and using emotional intelligence to make it more human
Hmm.
improves the communication between a doctor and a physician in the clinic setting, in the hospital setting, in the post-operative setting, and in the clinic. And I think that would make this relationship much more powerful. But say, for example, if you were wearing a wearable
Hmm.
and it was plugged into the Internet of Things, and you were to come into this ecosystem of this amazing new hospital that we just virtually created right now, and I was waiting for you, and I would know exactly that you had a minor heart attack, you had diabetes, and you have high blood pressure. But your blood pressure medication is coming out as you don't have the appropriate dose of the medication to affect your blood pressure. And in the last 3 days before you came to see me, your blood pressure was very, very high. Not because you were anxious to come and see me, but because of the pathology of your hypertension.
Okay.
And in 2 days' time, you have kidney failure. And in 3 days' time, you have a heart attack. And if you came to see me, guess what? I'd be admitting you into the hospital. I wouldn't just be sending you home and saying, you know what, I've got to wait for that blood test to come back.
Right.
That's nonsense. So that's how I think we can make a difference, and how this technology, if used in the right way, and the algorithms can be appropriate. See, the problem with IBM Watson and the misdiagnosis for cancer and then missing the diagnosis was the poor input of the data and how the algorithms were used. And so there was no emotion in that. And there was no personalized data that was placed in there. It was used out of context by just physicians just slapping a whole bunch of data into pathways which didn't talk to each other. And so that's where I think would be the power of what we could do with this technology, and how we could minimize the morbidity of what we can do in the hospital setting.
I see, I see. So you mentioned communication and data. And may I ask if time is also a challenge for you?
Oh, Yes. So if you're coming, I can't make the decisions at the time when you come to see me.
Mhm.
So I have to wait until 3 days' time. But guess what? You may have had a heart attack by then.
Right.
So I can't make better decisions at the time that I see you. And so if time's not included in that, algorithm, we're lost.
Right.
And there is no point, because the reason why I became a heart surgeon was because of time. And because things were moving so quickly, and instant gratification for me are important. And your heart beats about 100,000 times a day, so you've got to be on top of it, and you've got to make sure that you know exactly what you're doing.
Yeah.
And it's critical to know it with a temporal timeline, which allows you to um, make those decisions. And predicting it for me is, if I can predict sudden cardiac death within 5 minutes of when you're going to have an abnormal heart rhythm, or something structurally is wrong with your heart, and we can prevent that by um, shocking you or preventing you from going for that run, then you've just saved a life. And that is all about time.
Exactly. It's so incredible. Um, my friends who are surgeons always talk about time and how what a challenge that is amongst their patients, and especially in the OR. So speaking of time, you've covered a lot of the main points I wanted to ask. And lastly, I just wanted to ask you, what would you, Dr. Zain, like to be remembered for? It's a more personal question.
Yeah, well, it all depends on what level and what your definition of success is. So, um, I think definitions of success change. For on a personal level, it's really being a good family man with honesty and integrity. Um, but as a uh, scientist or surgeon scientist, um, I would like to use technology in a smarter way to. Um, what I do with heart transplants is um, try to prevent sudden cardiac death, and from the acute setting. And if I could be remembered for that arena, and then further on, using innovative technologies to, like, for example, we created an artificial heart in the lung with a pipe that goes through your heart while your heart's beating, and try to prevent, say, Takotsubo's cardiomyopathy or sudden cardiac death, and recover that heart. And so recovery in the acute setting of a heart, or the chronic setting, by using regenerative medicine therapies to remodel that heart to prevent you from having a heart transplant, would be amazing. And if I can't replace your heart, and because there's a scarcity of there's only 2,600 heart transplants done in the US alone, and 4,000 in the world.
Wow.
Um, I also put in artificial hearts. So the total artificial heart for me is the reason why I'm here. This is the birthplace of the total artificial heart in Arizona. And so I think that um, as a surgeon, I love would love to be remembered for replacing or recovering hearts, and using that in a smarter way. And the total artificial heart is just an amazing piece of equipment that can be made better. And so I think we can always do better with the technology. And I hope that we'll be able to fuse that with biology and improve disease. So I hope that answers your question.
Yes, that does. It's very simple and to the point and important. Um, and you mentioned Amy. Can I ask you what you like about her? If you can say two or three things that are really valuable in your eyes about our technology, what you see as her strengths.
That it's personal. I see that its strength is that it's personal. It becomes more tailor-made to what you are and the questions that it asks are important. I think it can improve. I think there's a long way to go for
Mhm.
it to be better
Mhm.
in terms of predicting your emotions. And I think you can only predict that if you have the biorhythms plugged in, because, like we alluded to before, um, emotion and physiology are interlinked. And so I think the it can become much more intelligent, if you like, emotionally, if the questions are more poignant and pertinent to situations, which, for example, if it's an app on the phone, it can identify whether you're running or not, or
Yeah.
sitting or lying or standing. And I think if you are involved in an argument, or why, and can it, premeditatively reduce some of the emotion, or prevent you from reacting in certain situations. And that's, yes, my ideal. But I think that you've got the infrastructure already in Amy to make that happen. And I think the algorithms just have to be tweaked to formulate a better um, realization of it. And I think for that, you need multiple inputs from multiple disciplines. And I think that's really where I'd like to see it. And in terms of where it is, it's got a lot of cool stuff in there, which can be harnessed in a more directed way to make it more personalized. And I think that would be perfect if it does work. And I think it's already working. You already have millions of people who are using the app. And I think that the feedback that you get from that, the use of natural language processing, and even deeper learning for understanding what it means to, for example, read between the lines of their answers, you'd be able to capture that substance um, in Amy, which otherwise you could read as emotion.
Mhm.
Excuse the pun. But I do think that it could work, and I think it's working now, but it can be better.
Yes, that's definitely the goal. Um, okay, and I think that you quite went into a lot of detail that I wanted. So thank you so much for your time. I know your time is very valuable. Um, and Dr. Khalpey, can I ask if it's okay, you're comfortable with us issuing an article with your name and this phone interview and bylining your name, and we can absolutely send you an edit for your review.
Yeah, yeah, it's fine. It's absolutely fine.
Great. And
And I think, yeah.
and did you have any questions for myself? I know we kind of jumped right into it.
No, actually, Carlos did tell me about you, and tell me that we'd have fun when we spoke, and I think we did. But I think that if there's anything that you feel you wanted to talk about further, we could. I think that adding, and talking about the space was important in the medical field. And I think trying to draw in the emotions with what we do, and specifically with the heart, for example, for me, makes it heart and breath, actually, for me, it was important. So if you feel that you need to add more, or something's just off balance and it's too polarizing in terms of the interview, then um, let me know. And I'd also love to help in the future. So let me know how that could be done. I think we're working together, and I know about the digital patient, and we're doing a whole bunch of other things with Salim. But I think um, I know why you're doing this too, in terms of legitimacy
Yes.
and what's going on. And so I do know the background from what Carlos told me, and I think
Okay.
um, I hope these answers come across not only to you, but to whoever's going to listen to it, as genuine, because that's exactly how I feel.
Yeah.
And there's nothing manufactured here. So, um, you know, I hope that comes across.
Yes, I did wanted to ask about, you mentioned about data and how
Yeah.
the dialogue, if the dialogue is more poignant, and so, and this kind of goes taps into your experience of knowing a patient's history and communication prior to meeting, because it's all there and it's all genuine and it's on record. So how would you like to see the questions, let's say for example, when Amy asks specific questions, would you like those questions to be a little bit more
Oh, I've already drawn out a proposal for Carlos,
oh,
and
wonderful.
yeah, I called it. Actually, it was just on a Sunday morning a couple of months ago when I fell in love with Amy, and I thought, wow, this has got potential,
Mhm.
and created something called Sentient Amy, or Samey. And I don't know, I just made up the name, but the sentient means that you're feeling, right?
Yeah,
So something that you can feel as a patient, and directing that is at multiple levels. And I think I can't, to answer that more comprehensively, one has to dive into the questions. I think the psyche of what you're trying to get to in terms of the psychiatric part of the questionnaire that
right.
you currently have, which was so extensive, I was yawning. Excuse the pun, but that needs to be improved. I think we can be more specific with the questions, and we can get much more pertinent data. And building the algorithms I can do in my sleep with when it comes to patients, and drawing in the emotional things. I mean, I've seen so many patients now that I know specifically what to do, and building a cardiovascular or a health module is easy to do with Amy, and I think I know how to do it. So I think it would really work. And also for family members. So, they usually come in with a family member
Yeah.
for support and structure. I think when you're asking specific questions about, well, how are you? And the reflex answer when they're talking to me in a white coat is, I'm fine. it,
Exactly, exactly.
it doesn't work. And so I think Amy can uh, unroof the real pathology, and you can, when they walk in, I think we can do this now, and if we build a health module right now, we could make it work, and you could test it out on your platform. And I think it's very easy to do. And trust me, as difficult as it has been for you and I to talk, uh, I will make the time, because this, I feel, would make a difference in what we do every day.
Oh,
And so I think we can work on that together, and it'll be improved.
well, thank
Does
you.
that answer your question?
Yes, that does. That, and I really genuinely, on behalf of myself and behalf of BPU Holdings, we really do truly appreciate that. You did bring up something I personally have always thought about. Um,
Hmm.
you mentioned how patients answer differently in front of you as a doctor wearing a white coat versus a lot of times they'll bring family member or close friend for emotional support. Do you feel that gender plays a role in the office, in your office with your patients when, and so so the what I'm really trying to come up is honesty, and the issue of honesty with your patients. And do you feel
Yes.
gender and this scenario of being in an office with those emotions and those heart rates going up, does honesty is that affected in your in the hospital and in healthcare in general?
So let me ask you a question before I answer that. So with the technology that you already have, because I'm going to answer your question for you in a way, I think you've seen that there's a difference between responses between male and female.
Yes. Hmm.
Right. So you know that from when, even in the US election, when women are voting for a candidate, or when men are voting for a candidate, and age has a discriminatory feel too. So when it comes to a patient coming in front of me, whether they're male or female, whether they're old or young, um, it certainly plays a huge role in how they respond. And in terms of what you have to do as a physician, and what Amy can do,
Mhm.
is to make them feel at ease. And so I've often found that when people um, look me up and they look up the institution that we're at and they see the team I'm working with, they feel comfortable. And when they come in, immediately one of the key things to make somebody feel comfortable is um, if they smile or if they, and you can't quantify that, can you? But Amy could
Right.
in terms of mood. And that's the question that always comes up with Amy, right? How do you feel
Yes,
right now?
yes, yes.
And so I think you can intellectualize that into gender. You can intellectualize that into when they're coming to see a physician, and you can unroof a lot of um, psychiatric pathology, but also know that you can numb the pain by bringing support of a family member, by bringing a child who can influence your emotions to say, well, look, Dad, you didn't really feel like that yesterday, and tell the truth. And so uh, they will tell the truth. And the purpose of my role is to make them feel comfortable because they're frightened before they walk in.
Right.
And when you put them at ease, if Amy can help in that regard, that would help from the, like, oh, we're going to see Dr. Khalpey in 3 days, and I know I need to have heart surgery, but the question comes up now, and over 3 days they're asking you, the questions come up, and you prepare them for when they walk in, and then I've never met them, and they tell me um, how they truly are. You're saving time, and you're also making them feel more comfortable meeting me, and so they know who they're meeting from the team. And if Amy were to produce that for them uh, by you creating a bot with that, and I know exactly how to create that, um, we'll be able to not really manufacture a artificial environment, but a real environment, which is human, which would make the patient communication and the doctor relationship work better, and the team relationship work better. And so when the there are many women who come in who are very scared, but often feel comforted by what we say in terms of, and that my delivery is the same with everybody, but it's different for each individual person
Mhm.
emotionally because people handle things differently.
Of course.
And somebody says you're going to die and you need a heart transplant or you need an artificial heart. I remember the first time I did an artificial heart in a Native American, and his mom, the night before surgery, his mom was sitting next to me and she said, well, if you take his heart away and you put an artificial heart in, will he still have a soul? And I was
Oh,
blown away.
wow. Yeah.
And so it's amazing what society sees, what different ethnic groups interpret as emotion, and what the significance is. And I can't take that for granted, and I don't think any physician can. So I think if we can prepare them better, will be able to make better decisions and help them. So yes, the gender is important and age is important, and so I think and belief systems are important. And so if you ignite all of those and you prepare those with um, preparing your emotions and calming you down, then I think you'd be able to really create something unique that no other, you can't create this intangible substance that Amy could produce, and I think that's what we're looking for, right? For
Yeah.
example, nurses on the ICU see a lot of patients die.
Yes.
There's a lot of burnout. You
Yes.
can prevent that by protecting them by using Amy or a sentient form of Amy
Yes.
in a very modular way, and similarly with families to prepare them for death and dying.
Mhm.
I mean, I can go on and on and on Alison, and you can see how we can explore and expand and explode the whole arena. And so I think I would be very excited to work with you guys. It'd be very emotional for me. Excuse the
I'm quite emotional right now, actually.
pun.
No, it's so true. I know someone with Alzheimer's, and unfortunately, Alzheimer's, the family members have the hardest time dealing with it when, it's not the actual patient, but the family members. So it's how do you prepare the family members? So it's,
Yeah, I mean, I it's scary because I've been in that situation, and when my dad was in intensive care, he experienced acute delirium after he had surgery for his lung cancer.
Mhm.
And I remember walking in to the ICU, and he was very confused. And I thought he wouldn't recognize me, and
Oh,
the morbidity of that feeling
right.
was. Can you imagine your own father not recognizing you?
Yes. Yeah.
Well, people feel that with a stroke. People feel that with acute confusion and delirium. So if we can prepare the supporting structure and say, you know what, and so I often tell the patients that this is what you may expect. 5% of patients who I operate on tend to do that. And so I think, other than all the emotions of the pathology of whatever specific disease it is, this confusion and the emotions that go along with that can prepare them, and they can be more supportive and saying. So when it was the nurses who explained to me that it would be okay. And yes, in medical school prior, I had learned and read and understood and everything about it, but my emotions confounded what was going on and wouldn't let me think rationally about, oh yes, this should be expected, and I've seen patients do this, but why is my dad acting like this?
Yes.
And so
Yeah.
I understand what you mean about Alzheimer's, which can be mortifying for the healthcare provider.
Hmm. Yeah, it's interesting. It affects so many people in so many ways, and emotion is such a big role and a big part and a big reaction and also healing. So it's funny how there's the argument of science and nature, but they're both and they go hand in hand. I believe they go hand in hand. Well, Dr. Kelby, thank you so much for your time.
You're welcome.
I really genuinely appreciated this, even on a personal level. I found this very even makes me think even more about uh, Amy and the possibilities. Um, but I did want to ask you, just off topic, if you watch Black Mirror. I know it's a bit
If I watch what?
Black Mirror. It's a series. It's on Netflix, and it's a series of short stories, I should say. And they're very twisted. And some can be quite creepy, but it has to do with technology in the future and how people interact in the future. And of course, it's beyond our future right now. But if you do have managed to get some time to yourself, and you're able to watch some TV, you should look into it. I
Yeah, no, I will. I'll let you know how it goes. And I only see this as a beginning of a long relationship with you, Alison. So I really hope that this will be a good foundation for us. And I know it is with Carlos and me. We're beyond the formalities now, and I think we should be too. So the best way to get me is only text, because my email I hardly read. Be honest, to be honest with you.
okay.
So as you know, I've missed so many uh, meetings with you. It's crazy because I've been operating or transplanting or whatever, and this time gets distorted. So feel free to text me because I'll often reply. And if not, there's only two things I'm doing. One is having dinner with my family, which I never interrupt, and the other is I'm operating. So otherwise, I'll always get back to you. And I
Oh,
hardly sleep, so don't worry.
Oh, thank you so much. I'm very flattered, and I really appreciate that the effort. And likewise, I certainly hope I can be of help as well. I'm usually the one keeping the team on schedule over here in Seoul, and especially Carlos's schedule. So
Yeah.
he always
No, I know he was very flattering about you. I
ah
think one of the things that I'd like to do is, the next steps for me are we're working on an app, but I think just an offshoot from this conversation, because it was so organic with you, maybe mentioned to Carlos that we should start thinking about a health module um, we could do, which has NLP, which is what your strength is, and we could create the health questionnaire that we want 3 days prior for the patient to come in and start moving with that. Because guess what? If we can create something, we can implement it immediately into a 200,000 bedded hospital institution, and we can trial it. And so, we can make it go wild. And I think you guys know how to do that already with Amy, where it's at in terms of prediction. And I
mhm.
think if we can predict fear, anger, or other things that you can do, and Carlos was telling me how cool, you guys can predict the trends well on social media. And I think if you can kind of jump on or piggyback on that in terms of the health stuff, and you already know what their profile is and how they think, then you'd be able to uncover a lot of things. And we could just strap that on and go into Banner Health, or right now the Cleveland Clinic are looking at something I'm trying to create, and I know a lot of people there because I trained with them at Harvard. Um, and so let me know if there's anything we can do to accelerate this, because I hate the status quo. I hate waiting, just like you, I'm afraid. So we have the same disease. But I think we can make something work if we actually, when I say we, I mean if you want to get all the right pieces into play. And then I'll focus and dedicate my time to making sure that we can do something.
Sure.
Because Carlos and I are both busy,
Yeah.
but I think that waiting for each other is painful sometimes, because
Yes.
I just see nothing getting done from
Yes.
before then. I see you as the engine of the whole enterprise, and I think from what he's described, and I think that you're somebody who gets things done. So tell me how I can help, tell me what you need, and tell me how I can do that for you, and
Sure.
I'll dedicate my time.
Sure. And when you say health module, do you mean with the questionnaire, the specific questionnaire that you need to improve, that you need the Q&A from your patients?
Yeah.
Okay.
And can you make it more emotional, and how can you get it out there, and how can you start, updating Amy to add that so that we're capturing it from the media or from everywhere else, and start co-building something new. And I think, and something that's organic to each person. So I think, because guess what? Everybody who you've got right now subscribing is going to see a doctor.
It's true. They say
Right.
in life you always need a doctor and a lawyer. And usually not for good reasons.
Yeah. No, I know.
Okay, yeah. No,
Lovely to talk to you.
yes, likewise. Thank you so much, Dr. Khalpey. I really genuinely appreciate your time.
No,
I
likewise.
have surgeon friends, so I know what you mean with the schedule and losing, not knowing what day it is. So, yes, I will bring this up with Carlos when I can grab him. And I do know that the dialogue was a priority because we can't have appropriate data without the right questions coming from
Correct.
the physicians, and in our case, sometimes psychiatrists, which we have used in the past. So I think marrying those two together, but also to be more specific, like in your case, dealing with sudden cardiac death, that is very specific. So the more specific, the better, actually. Uh,
Well, if you're talking about most pathologies like diabetes
mhm,
or hypertension, anything cardiovascular
mhm,
and thoracic
mhm.
is essentially a huge chunk of what we do. So most of the funding goes into heart disease, heart failure, and cancer. right? And the other stuff is bone. So I guess you've got that covered. So I think those are the kind of chronic diseases that add emotional pathology, which I think could be unroofed and captured by what Amy does.
Okay, that's great. Okay. Well, thank you so much. I hope you get to
Yeah.
enjoy your